Okay, ladies and gentlemen, we're going to start our recording on our second PowerPoint on your critical thinking, and it is actually on the critical thinking itself. This is a little bit longer, so I'm hoping that we can get it recorded in one setting and y'all can hear it without having any stress whatsoever caused by Miss Smedley. Okay, behind every healed patient is a critically thinking nurse. Critical thinking is your ability to focus your thinking to get the results you need. It can be the difference between keeping your patient and yourself safe or not. Okay? Thinking is not a static process. It grows and it changes daily, even hourly, even by every minute. Okay, because it is so dynamic and constantly changing. All nursing actions require thinking. It is important to understand general thinking versus critical thinking. And I have here for you, if you ever heard, give me one word that explains critical thinking, a good word to offer would be, what do y'all think? Reasoning. Anymore in preschool, even you hear the term, the 4 R's of school: reading, writing, arithmetic, and reasoning. Okay, critical thinking is very purposeful and outcome focused. There is no one definition that universally agrees upon, that is universally agreed upon for critical thinking. Why focus on critical or on clinical reasoning? Your patient will do one of two things when admitted to the hospital. They're either going to get better or they're going to get worse. Okay, you have to have clinical reasoning skills and know when the patient is getting worse and know what course of action to take to prevent them from getting worse. Okay. And the focus here is listed for you to have the ability to think in action and reason as the situation changes, and to focus and filter clinical data in order to recognize what is most and least important so the problem can be identified if present. Okay, I've got some scenarios for you here. A nursing assistant is assigned to give personal care to a patient who had a colon resection yesterday. She is thinking, I need to get this bath done because I've got 4 more to do before lunch. What type of thinking do you think this is? Usually thinking is routine and aimless, as in this scenario that I just read you, with routine and random thoughts running through your head. This kind of thinking has no purpose in nature. Okay, now let's look at another scenario. It says an RN is assigned to take care of a patient who had a colon resection yesterday. Before she gives care, she is making a plan of care in her head. She's thinking she has to, like, check his surgical dressing, check his vital signs for abnormalities, feel his skin for signs of poor perfusion, make sure his IV is on time and patent, be sure he gets up and ambulates to prevent post-op complications, and there's so much more that goes on in the nurse's head. Now, what kind of thinking do you feel this is? Scenario 2 is an example of critical thinking, which has purpose and it is solution seeking. The brain is like a muscle. The more you use it, the more capable it becomes. Okay? These two scenarios illustrate the difference between regular thinking, as what the nursing assistant was doing, versus that critical thinking as to what the nurse was doing. This ability of thinking critically is key in your excellence of nursing practice. Now, I'm going to give you a few more scenarios, and I want you to think about them, and then we're going to explore what we think they might be. Okay, like scenario 1, it's Tuesday, you're driving home on the highway, and these thoughts are going through your mind. I sure be glad when this week is over. I have so much to do. Critical thinking test on Thursday, paper due on Friday, work the weekend. I really need to get a haircut. Do I really have to shop for groceries tomorrow? Gee, what a good looking guy on the corner. I'm starving. What can I eat when I get home? Okay, that's your first scenario. What do you think about that? What type of thinking do you think this is? It shows aimless thinking with ideas and images that drift through our heads, okay? So that would be like the CNA in the other scenarios, correct? Okay, how about this one? It's Thursday and you're taking your critical thinking test. You're completely surprised by one of the questions. Your stomach is knotted. You think, I don't have a clue what this answer is. I can't believe I don't know this. I studied for hours. I don't think she talked about it. Maybe I went to the bathroom when she was talking about this. I've got to get myself together and think. 10 more minutes. I hate when this happens. So, what type of thinking do you think this is? This scenario shows some attempt at begin thinking, but you get stuck on the negative thoughts, okay? In here, you see where, it's over and over. I got to do this. I got to do this. I got to get back to this. Why does this always happen? That's all negative thinking, okay? And you can get stuck in those routines. Now, let's look at a third scenario. It's Friday. You had a bad week. The critical thinking was terrible. You were stressed out and worried about your paper. You finished your paper in the last minute rush. You look ahead and feel overwhelmed with the assignments and the commitments. You think to yourself, I got to get organized. You sit down, you figure out the most important goals, develop a sensible plan to reach those goals. You develop a daily and a weekly schedule designed to help you stay on track. You make an appointment to talk with your advisor about resources that are going to help you problem solve. So what type of thinking do you think this is? Yeah, it shows focused, deliberate thought. You're taking control, getting organized, and begin to think critically. So the key difference is thinking and critical thinking between the two is control and purpose. Okay? Once I asked a student how she went about answering test questions. She replied, usually I read the questions carefully, then I hem and haw about it. Critical thinking requires reasonable, reflective thinking. It may require you to hem and haw. Okay? Another expression that describes critical thinking is aha. You say aha when you suddenly realize something or have a suspicion confirmed. You say aha. When we connect with something that was in the back of our mind but never put into words, when our gut feelings tell us something is right, that is your aha moment, okay? Experience is suddenly gaining awareness or insight into something that we have been trying to understand. All of the faculty here hope that you do a whole lot of hemming and hawing on your test, and you finally, and in your other care, and then you finally get to that aha moment, okay? Components of critical thinking. You got your left brain and your right brain. Your left brain thinking is logical and it's problem solving. The right brain thinking is creative, intuitive, and prevents problems from happening when at all possible. Critical thinking can include these items that I've listed here: identifying and challenging assumptions. When there are assumptions out there, you can identify them and you can challenge them. Are they correct? Okay, challenging the importance of context. Is what you are hearing or seeing or your patient is expressing, is it important? Okay? Imagining and exploring alternatives. how else could we do this that might better fit that patient? Okay, reflective skepticism. Yeah, I can see where that would work, but maybe we can find a better way to work. Okay, or making good arguments, and this is where one person says, well, this is the way it should be done. If you can make a good argument and show evidence and proof that it's better done another way, then you will be revolutionizing the nursing profession. Okay, and that's where we hope you guys all get to. Creative thinking is critical thinking is a skill that can be taught and improves with practice. Practice makes perfect. Okay, expert nurses use critical thinking, and this is from Brenner, who is one of our main nursing theorists, right? Characteristics of critical thinking people. This is, what do you see in a person that is a critical thinker? They seek the truth. They are always truth seeking. They're very analytical. They're inquisitive. Okay? Critical thinking shows self-confidence. They are very open-minded. They're systematic in their thinking. They're very mature and they're very creative. Okay? Others that you could see are things like confidence or contextual perceptive. In other words, putting all the parts together. They tend to be very flexible. They have intellectual integrity. They have intuition, perseverance, and they are reflective. Now, I want you to take a few minutes, and on these that I have listed here and those that I've just said, I want you to put a W by the characteristics that you have developed well at this point in your life. And I want you to put an I by the characteristics that you feel that you could improve upon this year, okay? And this is not for you to have to share with anybody. This is just for you to start using that critical thinking. Think ahead. Think of how you can change the way that you are adapting. Now, the next slide is the 5 modes of thinking. This is very important. You need to memorize this, okay? You will be revisited by this several times. And the acronym for it is THINK, okay? The T stands for total recall, the H for habits, the I for inquiry, the N is for new ideas and creativity, the K is for knowing how you think. Remember, it is not how smart you are that counts, it's how you are smart, okay? And we're going to go through each one of these, all right, because you need to know what the definition of each is. So what is total recall? Total recall is remembering the facts, knowing where and how to find them when they are needed. So we don't expect you to memorize every little thing. But if you have a patient that is having some complications from CHF, can you remember where to go to get that information if you cannot pull it up in your brain at that time? Okay? There is so much out there that no one person can remember it all. But if you know confidently where to go to find that information, like lab values and your policies and procedures will help you with your total recall. Okay? And those are places where you can go find stuff that you need. The next one, or the H, is habits. Habits are thinking approaches that are repeated so often they become a second nature to you. Okay? They result in accepted ways of doing things that work, save time, and are necessary. People often describe things that they do habitually as things I do without thinking, like tying your shoe or brushing your teeth, that type of thing. Nurses, they will get to where they automatically go in. The first thing they do is they'll grab that wrist to check that pulse, you know, that type of thing. It's things that you do without even having to think about them. Inquiry is, the I stands for inquiry. It means examining issues in depth and questioning those that may seem immediately obvious to you. Okay? In other words, inquiring minds want to know. Okay? So, are you examining the issues? Are you striving to find out the why behind everything? The N stands for new ideas and creativity. New ideas and creativity comprise a thinking mode that is special to you, going beyond the usual. This is at the opposite end of the spectrum from the habit mode. Excuse me. This is where you maybe you walk in and you see that your patient has a very awkwardly placed stoma, for instance. And sometimes you have to get pretty creative with how you get those wafers on those bags in order to keep the integrity of the patient's skin. Okay, that's one way I think of new ideas and creativity. Sometimes you just kind of have to engineer things that you're working on. Now, knowing how to think, or the K, the last letter in it, knowing how you think means thinking about the way in which you think. Okay? Do you think without thinking most of the time? Or are you a critical thinker? In other words, is it just out of habit? Or are you actually purposefully thinking and concentrating on something? Next is the 5 rights of clinical reasoning. You have the right cues, the right patient, the right time, the right action, the right reason. You need to make sure you understand your 5 rights and you know these, okay? We're going to go through each one of them now. The right cues are gathering data or cues about your patient, knowing what is relevant and what is irrelevant data as to what you are trying to do with your patient, knowing the relationship between data that you collect and the disease process. So in other words, you kind of need to know pathophysiology of a disease process in order to make sure you're collecting the right data. Okay? Not knowing the right cues can lead to failure to rescue your patient. Okay? If you don't have those right cues down and you don't understand those cues, then as it says here, you could fail to rescue. It not only fail to rescue, you can fail to see improvement as well. All right? So now let's talk about the right patient. Know your patient is knowing if your patient is a potential patient for complications. Are they at high risk for those complications that can go with some of these disease processes? Do they have cues to be the right patient that are going to go from bad or going to recover? Okay, you need to make sure that you understand where your patient is in this continuum. Do they have not only the one disease process that's going on, but several comorbidities that are going to interact with it? The next one is the right time. Timeliness to identify high-risk patients among the many patients that you will care for over the shift. Okay? Do you know which one can you prioritize? Which one of your patients you need to see first? And you have probably already noticed on your tests, the last couple of tests, that you have had a few of these prioritizing questions, okay? Performing interventions in the right time, in the right sequence to prevent complications or even death. In other words, do you know what you need to do? The ABCs, remember, prioritize your care: airway, breathing, circulation. Okay? Now, the right action is taking the right actions. Facts in a recent study have shown that half of the cardiac arrest patients showed clinical signs of deteriorating for 24 hours before they arrested, and were only acted upon about half of the time by nurses that were caring for them. So you could see this is a failure to rescue your patients. Okay? Right reason, understanding the why behind everything that you do in practice. Put all of the pieces to that puzzle together, okay? Every patient is different. You can't put a square peg in a round hole. Know your patient, know their patho, know your relationships among them, okay? So like I said earlier, how are you going to be able to rescue your patient if you do not understand the pathophysiology that's going on behind them? Why is it happening to them? Okay? Facts that affect doing, your values, your beliefs, your expectations. Okay? Standards, laws, policy, and procedures, independent and interdependent role functions, and then levels of expertise are what we have here. Think about how each of these affect critical thinking and doing. And you need to know these as well, okay? Things that you cherish or value, like a walk in the park, those are your values, okay? What you place importance in, that's your values. Like honesty, integrity, your time. Maybe you value your time. Okay, what are your beliefs? The beliefs are absolute thoughts in which you trust and believe to be true, like religion or your faith in God. Okay, it might be a belief in anything. You might believe that every patient that comes through the doors of the ER is seeking pain medication. Okay, if that's your belief, your patients, I feel sorry for them because they're going to do without a lot of pain medication that they rightfully need. Okay, your expectations, they could be low, medium, or high. They are what you expect to happen or what you expect to see. So, and we always want to keep our expectations high, okay? Obstacles to high quality thinking are like habits and ruts, anxiety, age, and moral development. Okay, habits and ruts are the habits that you're not going to the other end of the spectrum for. Okay, rut is something like mine is better than yours, or resistance to change. Okay, these are things that encourage nursing, and I know you've all already heard this, to eat their young. Okay, anxiety, if anxiety is very high level, it will decrease their self-confidence. It will inhibit their ability to think and to organize. If your anxiety level is low, or the patient's anxiety level is low, this can enhance their vigilance, okay? So they are a little more alert and a little more prepared to hear, okay? But that is a balance that has to be maintained, and you will learn more about that when Miss Wilson goes through the psychological nursing with you, okay? In age, you have the very young and old, okay? Like your computer age. Most people don't reach the highest level of moral development according to Kohlberg's, and I'm sure Miss Candler went through that with you. Now here's a couple of exercises for you. Jack and Jill were found dead in a small puddle of water surrounded by pieces of broken glass. There was no blood. What happened? Can anybody tell me what happened? Well, were you stuck in a rut on that one? Okay, or were you in a critical thinking mode? If you were stuck in a rut, you were saying Jack and Jill went up a hill. Wrong. All right? If you're in the critical thinking mode, the first thing that should pop into your head is, who is Jack and Jill? Okay? From reading this, Jack and Jill to me are fish. Okay? And the cat knocked over their fish bowl and broke it. All right? How about the other one? How did the soldier fit his big tank into his house? What do you think about that one? How did the soldier fit his big tank into his house? Obviously, are you critical thinking or rut thinking? If you're rut thinking, you're thinking a tank that shoots out great big cartridge shells, right? If you're critical thinking, you're thinking a great big fish tank. Well, he carries in the great big fish tank into his house. You know, something like that. All right? Critical thinking and clinical reasoning is more than logical thinking and problem solving. Ideally, nurses should prevent problems from happening. This can be done by use of your nursing process, which necessitates use of critical thinking. And I have listed the nursing process here for you, but like I said before, Miss Qualls is going to be doing the nursing process for you. Make sure you understand the steps in the nursing process. Every step in this process involves critical thinking. Okay? Now, on our last slide, so why are we focusing more on clinical reasoning and less on NANDA and care planning? I have given you a link here, and I want you to watch this because it is, I see dead people walking, and it is very eye-opening. Okay? If you have any questions, please let me know. I hope you enjoyed this, and I hope this one has been a lot less stress causing for you than my last attempts were.